So what as I said, the idea, I mean, I'm presenting as Rain Foundation, but I have to really, really call out AHA. And in the first team happened to be the Implement HF, the heart failure team. And the goal here, in pushing this health equity is how can we create these more accessible and affordable solutions for care at home in local languages, to be able to continue in local languages, and then that suit in their lifestyle. And pretty much everything that we're building, at Rain at least, is all open source, so anybody can use it. And then the service we provide is free, right? And very soon this will also be available within the AHA App Store. So the idea is, as I said, is how can we focus on like these pillars, right? Nutrition management, stress management, and exercise management. These are obviously important, whether you have any health condition or not. But if you do have a health condition, then how do we make it easier for medication management, vitals management, and symptoms management? The goal, I mean, while understandably, like all this conversation, the focus needs to be very much on where the patient interacts the doctor. That's where the most important thing happens. But outcome is really driven by what the patient does with that advice and what information can they bring back. So when they come back to a follow-up visit, or when they're at home, are they doing the right things to be able to avoid emergencies? And then they can, in the US, it may just be, the payer paying things, but in general, some other countries, if they have to pay out of pocket, how do we generally improve outcomes for these patients? But for providers too, it's better patient engagement, so they can, if we are successful in processing all that data, and take the data that the patients bring along with them, they show a screen of how their weight has been changing, of the trends of if they had chest pains, and there's also a daily check-in type of thing that generally where they're feeling better or worse every day, what was their energy levels every day. So they can, the doctor can see these kinds of things and make better and informed decisions. And hopefully it will reduce the visits to the doctor, so the doctors can see more patients and scale their service, right? So that's the goal behind the platform. And again, doing it in such a way that the monitoring is easy, and even if bringing things like, if you don't feel like opening an app to enter the values, you can just say things, and you can say that in your conversational language. So back to the AI machine learning model question that came up earlier, just in our own experience for nutrition management, we first said, it'd be really cool to just take a picture and we automatically detect the portion sizes and calories intake. But then, we found that's a very complex model to build. I mean, everybody knows, I mean, not that we found, but if you change the setting, in the US, people could be eating, like pasta, pizza, different things, different days. But if you go to some rural parts of the world, they're consistently eating one kind of food. Like in rural India, it's like rice and curry, for example. That's a relatively easier model. But then, while working through that, we figured, I mean, do people really want to take a picture, or is it more convenient for them to just say what they ate? If that, right? So it has to be so easy for them to say what they ate, and we can determine the calories easier. So the point I'm trying to make is, practically not just running around trying to build models, but there are easier ways probably for us to, benefit both the patient as well as the doctor. I'm going to show how we use the Rain Health Guru app for daily check-in and to track symptoms, vitals, nutrition, etc. When you first open the app, you get a check-in once a day asking how you're feeling. Let's say I indicate that I'm feeling better. Then you get asked, how is your mood? I'm happy. Then how is your energy level? You're able to get off the bed, climb the stairs, exercise. Let me say I am able to exercise. And now I'm done with my daily check-in. You can now keep track of your symptoms. You can mark your symptoms as getting better by swiping left to right, or worse by swiping right to left. And once I'm done with my symptoms, I can then indicate my medications. So I get my reminders of the medications for morning, afternoon, evening. If you want to add another medication, you can go into add medications and you can add a medication. You can also select an icon to remember a particular type of medication. And once you respond to your reminders, the history of the medications can be tracked on a monthly basis. You can also track your vitals, like weight, blood pressure, blood glucose level, blood oxygen saturation, pulse rate, body temperature. And you can track the trends of those vitals that you can share with your provider when you meet them. You can mark your nutrition in terms of what you're eating for breakfast, lunch, and dinner, or a snack. Over time, we'll make it much easier for you to track these just by interacting with text and voice. So for example, I can say my medication, and then it will show that I need to take a medication immediately. So likewise, in future, we will be able to interact. If you're not in a mood to touch a screen and you just want to interact and get responses, you'll be able to do so with either texting or voice recording. There's also knowledge articles that can be pushed specific to a health condition that one can either watch, listen, or read in this knowledge window. If in case of an emergency, by pressing that bottom right button, you can indicate that there is an emergency if you end up having to go to a hospital. Also, there's handy phone numbers that you can have, like a doctor, nurse, a social health worker, and a family member that you can launch a phone call or a text message. You can also upload your records, medical records. In future, we're also going to be adding a capability to be able to comprehend a record. For example, if there is a discharge summary of 50 pages, we make it easy to create a one-page summary of the medications that were given or the symptoms that were exhibited during that admission. So it's an easy way to share that as you go from one provider to another provider. Once the care plan is integrated, as we discussed, you'll start seeing, today you'll see only medication reminders here, but once the care plan is integrated, you'll start seeing actions related to nutrition, exercise, meditation, etc. in this care plan to make it easy for you to go through your care plans. All right, thank you for attending the presentation and watching the demo.